The frustration of a mother who wants the best health for her child. But sadly, healthcare is not always accessible. It's our duty to wipe away the frustration, one teardrop at a time. In most rural areas, access to basic child healthcare services often requires a mother and her baby to make long trips to the nearest health facility. It takes a mother and her baby hours to go there, where they often have to queue due to limited clinics.
My family and I would have to travel very long distances to get the proper healthcare needed. And getting to the next healthcare center would mean I'd have to pay 600 kwacha for each trip, which we cannot afford.
Kombedza, the nearest health center, is 18 kilometers away from Timpanga village. In a country where nearly half the population lives on less than $1 a day, 600 kwacha is more than most poor households can afford.
Even after reaching the health facility, it is not uncommon to find that most of them are under-equipped with measurement performed manually using tape measures and manual weighing skills. This process can be inaccurate and inefficient. This chart from UNICEF shows us the number of deaths per 1,000 live births as of 2017. Though the number of deaths have significantly decreased over time, the rate still remains unacceptably high, with Africa having more deaths compared to the rest of the world. There is need for a way to reduce this high rate of infant mortality in Africa. Our proposed solution addresses these gaps through improved access to healthcare. Our solution can be used remotely by mothers at home, away from hospitals or doctors. The IoT device can be used to monitor growth parameters like temperature, height, weight, and skin conditions of the baby, and immediately send them to the doctor remotely. The collected measurements are then filtered and compared to get medically relevant insights in the form of health alerts. To generate alerts, the data collected is compared against WHO statistics to evaluate the baby's growth. The alerts and charts generated by the application can be viewed and analyzed by the doctor for immediate intervention. Our envision impact of the proposed solution will be more timely administration, treatment for patients at the comfort of their homes, significant reduction in the cost of intervention, and improved quality of healthcare. One of the team members was in charge of designing and building the IoT device for remote screening using sensors to screen infants for their temperature, weight, height, and skin conditions. This screening can all be done at the comfort of their baby's home by a community health worker or by mothers without medical skills due to its user-friendly nature. Existing remote patient screening solutions do not focus on routine infant screening, making it one of the only solutions in this modern age.
I was in charge of developing the IoT end of the proposed solution. The IoT device makes use of an Arduino Mega 2560 board to assemble the components, an Ethernet shield for internet connectivity. We used a load cell sensor for measuring weight, an ultrasonic sensor for measuring height, and a temperature sensor for temperature. We also have a GPS sensor for location, a potentiometer to divide the voltage, an LCD display to validate the measurements taken, and a camera to take an image of the skin condition. One of our team members was responsible for designing and developing the web application. This web application can be used as an interface for various stakeholders of the project. This is the home page and the about page. The process begins with the healthcare provider creating an account by signing up. The signing up process requires the doctor to fill out some important information like their first name, last name, username, address, phone, job title, gender, email, and a password. The doctor will then log in. Once the registration is complete, the doctor then signs into the application using the credentials just created. When a baby is born, the initial registration of the baby takes place. The baby's information is keyed in, such as their first name, last name, gender, date of birth, the parent's name, and the parent's phone number. We have registered a baby called Mark Alex. After the registration is complete, the baby then gets a unique registration number that must be scanned every time measurements are taken. We had to simulate the process of taking measurements of the baby without using an actual baby. To measure the weight, we used a 2 kg load. Upon weighing it with our IoT device, you can see the measurement is 1.96 kilograms, which is very close to the actual weight. The next step is to take the temperature of the baby. After the temperature has been taken, the LCD screen displays the temperature that has been recorded. Next, we measure the height using the ultrasonic sensor. To show the accuracy, we place an object 8 centimeters away and place a ruler next to the sensor to confirm. We can see it accurately measures the distance between the sensor and the object placed as 8 centimeters. To simulate the skin conditions, an image of a baby is placed on a wall and the camera takes the image. All the data is then sent to the database.
I was in charge of writing the code which writes data to the database after the measurements have been taken by the IoT device. You can see the measurements you have just taken have been recorded in the database under the name of the baby, Mark Alex. The measurements taken are then compared against WHO threshold values and alerts are generated accordingly. We had a team member write code for analytics which includes generating growth charts and the machine learning API. This is the dashboard where the doctor should be able to access the measurements that are just taken and some global charts used to view the information of all the babies based on the location. Our webpage also enables the doctor to download the data as CSV and JSON formats. These files can also be pushed to other health information systems such as the popular DHIS2. The doctor can click on the record for Mark Alex to view the baby's measurements. We can now see that the measurements have been recorded and displayed successfully. We have an API that integrates with the visual recognition tool to conduct image recognition. The results from the visual recognition tool shows us that the baby has a rash and the corresponding score has also been displayed. The status of the infant is critical. This is because measurements taken of the baby are outside the normal ranges. Our web application also has a filtering feature which makes it easier for the doctor to locate records. Let us pick a baby who has been measured several times and look at how the growth pattern chart looks like. We can see the baby details on the left and the alerts on the right. This record has the status serious because 3 parameters are outside the acceptable range. We can see the baby is underweight, under height and has rashes. The doctor can view the growth charts for weight, height, skin issues and temperature of the baby. The growth charts contain plotted threshold lines to make it easier for the doctor to understand the extent of the issue. The charts also have a functionality to remove irrelevant threshold lines according to the gender of the baby. In our case, the baby is a boy, thus we remove the threshold lines for a girl.
The system design was driven by several requirements which we shall discuss next. The proposed solution is very user-friendly. It makes use of an LCD screen for the users to confirm the readings. It uses the principle of automation to perform growth monitoring. The IoT can work with unreliable internet connection by temporarily storing data until the connection resumes. The user requires a minimal learning curve to use the IoT device. The picture on the screen shows how the LCD screen can be used to determine the accuracy of the IoT device, hence making it very user-friendly. The web application can also be used on a mobile phone for ease of accessibility. The assembled device can fit in a 20 by 20 by 10 cm box. Users in marginalized communities need devices that can be easily moved around to facilitate sharing within the community as necessary. The assembled device weighs 0.65 kilograms as shown when placed on the weighing scale. The total cost of the assembled components was $93 as shown in the table, which is equivalent of a middle to low cost smart mobile phone. This cost can further be reduced by mass production and communal sharing. These are the accuracy levels for the sensors we use to construct the IoT device. We can see the sensors exhibited acceptable accuracy rates. We tested the image recognition module with different types of images, a clear image, a blurred image, and a black and white image, and we noted that our visual recognition model was still able to accurately classify the images with acceptable accuracy rates. Resource requirements. Our IoT device can be powered by a single lithium-ion battery, which is very cost-effective, and this battery can power the device to a maximum of 2 months. Our device requires a 3G data connection to send the data to a cloud storage for further analysis. The mobile service providers in Kenya cover almost all rural areas, therefore, they can access the internet. Due to the sensitive nature of user medical data, all the aspects of our design incorporate strict security and privacy measures. The web interface provides an opt-in consent module before the registration takes place. This implies that the users have read and confirmed the terms and conditions. The web application also offers an opt-out interface for users to delete their profile. This ensures that the user has additional control over their data. The passwords collected by the web application are encrypted and stored. Hence, the passwords are only known by the user. The web application also offers different access levels to different stakeholders. We currently have 4 access levels, namely administrator, data analyst, doctor, and a registrant. This is the dashboard of a data analyst. It only contains global charts to be visualized to gain more insights from the data collected. The data analyst cannot access an individual baby's information. In conclusion, we envision that our proposed solution will have significant social, economic, and industrial impacts. Economically, the proposed solution will reduce the strain of overcrowding in health facilities. It will provide a quick option without the lengthy administrative procedures conducted at the health centers. For mothers, it provides a cost-effective option, saving them the long trips to the nearest health facilities. For infants, early intervention measures can be taken, which ultimately reduces the infant mortality rate. The solution will help developing countries fulfill the third SDG goal, which strives to ensure healthy lives and promote the well-being of all ages. The proposal also fulfills the 9th SDG goal, which provides a roadmap to many innovation initiatives that researchers in many developing countries can embrace. The data collected by the proposed solution can be useful in making decisions by the government. The government can then identify where resources are required the most for proper planning. The future work on our project will include adding sensors to measure infants' breathing pattern and heart rate. The image recognition module will also be improved on by finding ways of making the input process less involving for the caregiver. The solution will be commercialized for proper packaging and marketing purposes.